Good morning. It's a beautiful day, and it is Tuesday, and we've got Dr. Geraldine Tan, award-winning therapist of the Therapy Room. Good morning, Jerry.
Good morning, and the weather here in Orchard is bright and sunny.
Love
Yeah. And you know who's having a very good morning? In fact, they'll be having good mornings all week long. The parents across the island whose children all made it back to school this week. Yay!
Well done. You survived the June holidays.
I don't know whether they are happy. I think they're happy when their children are back in school. But the morning routine is something that we need to get used to all over again after 4 weeks of break.
But that's okay. I mean, at least you have the rest of your day, significant part of your day, which is all to yourself, you know?
Yeah.
You don't need to crack your head like, what do we do today?
Yeah.
Oh my gosh, it's raining. What's the rainy day plan? And, you know, things like that.
And I gotta tell you, I'm feeling it because this is the first year I've had to deal with the June holidays because Charlie went to primary 1 this year.
Oh.
Prior to that, I mean, you know, with the preschool, the kindergarten and all that, even during the school holidays, there was still stuff for them to do. There was still school to go to.
Really?
Yeah.
Oh,
'Cause
wow.
It almost doubles up as a daycare as well.
Oh, okay, got it.
But this was the first time where June holidays we were like, oh no, how are we going to occupy him?
I got some good news for you.
What is that?
The December holidays are even longer.
Oh, thanks. Thank you.
You're welcome.
Such a ray of sunshine you are.
Okay, so this morning, Dr. Jerry, we're talking about procrastination, and it's something I feel that we are all guilty of, you know, to some effect.
To some degree,
Yeah.
to some degree, all of us have that procrastination, right? Or have done procrastination in some way or form. I thought, you know, the school started, and one thing that I always hear in my sessions are, you know, parents complaining about the kids not doing what they ask them to do.
Yeah.
Like, why do they want to delay this, delay that, you know? I have young people or young adults coming in and say, you know, Auntie Jerry or Dr. Jerry, you know, how come I would wait until the last minute before, you know, doing my project or doing my assignment, you know? And I think I was journeying with one of a young girl who was in Polytechnic. She's graduated, and she was struggling so much with procrastination. She just couldn't get that final project done. So I thought it would be interesting to talk about it today.
I mean, I'm just thinking as you're talking, like, why do we do it? We know in our heads that it's so good to get things out of the way.
Yep.
You know, get things completed. Like I'm sure you would work this out with your children as well. If you finish all your homework now at the beginning of the holidays, you can enjoy the rest of the holidays and I won't bug you, right? But that doesn't work.
No,
Not even for adults, you know?
I've always just thought, you know, and perhaps it's just a very naive and simplistic way, it's just lazy lah. You know, I mean, that's always easy to, that's the go-to, right? It's
and then when you really have to, you have to get it done, right?
Yes.
Yeah.
So reasons for procrastination.
Yeah, so Tim, you mentioned about laziness. So it is not laziness, okay? So we cannot just label it. But procrastination is also interesting. It's not a clinical disorder. So despite us talking about it today, you cannot say, I'm diagnosed with
I'm suffering from procrastination. No.
It's not a mental health condition.
I would love to see that on an MC, you know what I mean?
Right.
You couldn't come to school today, why?
Procrastination. I'm suffering from a bad case.
And it is not poor time management. So a lot of people mistake it and say, oh, I've got poor organizational skills, I got poor time management, that's why I procrastinate. So it's not about that, you know. And the person that procrastinate knows that there are negative consequences also. So they know that they will bear the consequence. If you miss a deadline, you know that there are negative consequences. If you don't go and brush your teeth, you know that your parents are going to scream at you, right? But yet you still engage in that behavior. I guess what causes it? What are some of the causes, right? One, I would say a big one is emotions. So I have emotions personality, motivation, and the clinical disorders that cause it.
Okay.
So emotions, what do I mean by emotions? There are many times that we fear a certain task. Yeah, I fear I can't do it as well. I'm not good enough. So there's that insecurity or the anxiety. So you put it off. Or, for example, I think recently I heard this being said, I put off talking to my manager because I fear talking to my manager. So despite that conversation, being very essential for performance review and things like that, this person put off or procrastinated in talking to the manager because they feared the encounter with the manager.
So it's always obviously things that we don't like.
Yeah.
Right? Procrastination. It's never procrastinating on things that you are looking forward to.
It's not, we're not procrastinating from things that we're comfortable with. Like,
Yeah.
for instance, when I hit the snooze button, I procrastinate. I don't want to wake up for another 10 minutes. It's because I'm tired.
Yeah, of course.
I don't want
yeah.
to face the day. And when I put off going to the gym, because I know I will pain. I will feel the pain. I will feel the ache. So,
And it's an effort.
Yes.
It's a real effort.
So yes, you're absolutely right. So what are some other feelings that you think pushes us to procrastinate? So tiredness. So Tim mentioned tiredness, right? Yeah. So that can be a feeling, but that's a physical feeling.
Discomfort,
Discomfort. So something that brings you discomfort. Yes, you might not want to engage in it. So
Anxiety.
I'm getting us to think about all these because we want to be aware about these feelings for ourselves, as well as, the parents being aware what the children might be going through.
I feel another one is delusion. I have deluded myself into thinking that I work better under pressure last minute.
My
and so I put off
gosh.
assignments and things like that until just before the deadline.
I think that's just an excuse. I think delusion is an excuse.
I have a different word for it, Tim. So we call it cognitive distortion because this pattern has happened so often. You need to make sense of this pattern. So then you have that cognitive distortion and you tell yourself, I do better under such and such circumstances. Or you overestimate your ability and say, okay, I can get it done. So people get it done in 3 months and you get it done in 3 hours. So because of the procrastination and the emotions that push you to procrastinate, you may tend to have cognitive distortion. And that's what the students tend to tell you, right? Like, oh, no, don't worry, I can get it done in 3 hours or in a day, or they say, oh,
Plenty
it's
of
just
time.
a few more, it's just a few more, papers, I can complete it. And then when the parents look at it, you go like, you mean you have so much homework left and you still leave it till the last minute?
Yeah.
But because of procrastination, they distort it. Yeah?
All right. We're talking about procrastinating, and you did encourage us to try and think of the different ways, reasons why the average person may actually procrastinate. Do you think this is a pattern that starts from young? I mean, as a student or as a child, you started procrastinating maybe from doing your homework and then you just kind of got into it. And, years later, you're now an adult and you just can't get out of that cycle.
Yeah. So we looked at emotions. So the emotions that push us to behaving in a certain way, if we don't realize that can become a pattern for us. And I think you illustrated about the cognitive distortion. So we start to explain away our behavior and we engage in that behavior. So then this behavior becomes a familiar pattern that we continue through life.
So we can become pathological procrastinators because some people just continue, they continuously say, I'll do it later. Like I'm trying to, whenever I think of something and my head says I'll do it later, I go and get it done. Like, oh, I need to clear the desk. or whatever it is, and you walk past it, you're like, oh, it's fine, I'll do it later. But I'm trying to make this conscious effort of actually stopping, doing that first, and then doing whatever it is later on, so that the procrastination becomes a lot less.
So what you're doing is you're changing a behavior. Yeah, so you're breaking that pattern, and that's what we encourage the children. Our parents try to encourage the children to do, but sometimes it's very, very difficult, and you mentioned about clearing a clutter. So we talked about different emotions like fear, anxiety, but there's also one more emotion, which is boredom. So if I'm bored, I would not feel inclined to actually partake in that particular task or activity.
Okay.
So a lot of people, a lot of parents, and that's where we get into a little bit of a tug of war with our children, right? Go and study instead of playing the computer. But studying is boring and mundane and a whole host of other things that we're going to talk about, like I don't feel I'm going to do well enough, so that insecurity, the low self-esteem. But on my computer, on my game, I can level up. I know exactly where to go. I feel very motivated. So one of the areas that I was talking about besides emotions is motivation, where our motivation lies.
So a good way to get past procrastination is actually to make the stuff that you don't want to do seem more interesting, less boring.
Yeah, which in itself is quite a challenge.
It is. But I mean, like when it comes to kids, if you think about it, they're like, oh, I don't want to study history, and I don't want to do science. But you realize that they don't want to do these things because they don't know them.
Yep.
As soon as you understand math, it becomes so easy,
Yeah,
right?
we want to do things that we're good at, right?
Exactly. Or science or history or whatever it is. Okay.
Now, Dr. Jerry, earlier on you mentioned, right, procrastination in itself is not a clinical disorder, but there could be clinical disorders that could lead to a pattern of procrastination. What are some of these disorders?
Yes. So we have so earlier I spoke about like the emotions, the motivation, personality. So before I go into clinical disorder, let's use a bridging another category, personality. So those that are very perfectionistic, so those that are very perfectionistic, if they think they cannot get it right, they would not want to do the task or do the activity.
So people with OCD, does that lead to?
I was going to segue into that. Yeah, so you can have a perfectionistic sort of personality, and you can have also a disorder. So OCD is one. So if you are a bit more obsessive compulsive in wanting things done in a certain way, you may procrastinate also. So that is one of the clinical disorders that may push us to procrastinate. The emotions, depression, anxiety. So you might feel your mood, just taking over your whole person. You might not want to do things, so you might procrastinate also. So it can lead to that. I love this one because a lot of times people with ADHD, attention deficit hyperactivity disorder. So I'll share mine, which is, if you send me an email, I might not reply you because it's just too much for me to, I can read it, but to reply an email versus replying a text, it's very, very different. The vibe is very different. Answering a text is less formal. I can answer and get to it quite quickly. But an email is rather difficult. So I procrastinate, and my team knows that I procrastinate in answering that email.
I wanted to just touch on something because earlier we were talking about being lazy because, and that's one of the things of procrastination, but also being tired.
Fatigue, yeah?
Fatigue, like, you sometimes your brain doesn't want to think. That's why you don't want to reply that email because it just takes a little bit more effort, so it may not always be laziness. It could also be a really, really hard day at work,
Yeah.
or you just want to switch off, and that's it. I don't want to do anything else.
Yeah, so it takes more effort. So when you're tired or when a task exhausts you, you might find the task so effortful that you might not want to do it.
Okay. All right. So, as you were mentioning, these clinical disorders, personality issues and things like that, those can actually be treated with therapy, right? Does that mean once someone improves in those aspects, then it also helps them to break out of their cycle of procrastination?
Yes. So a lot of times if we are able to target the why, so earlier we went with all the different emotions, which all of us can start to tune ourselves into the emotions that a task brings forward, right? Or brings forth. And, we can manage it. Once we manage it, we would be able to perform the task much quicker. So, for example, for some of the parents, right, they say, oh, but my child doesn't want to get up and brush their teeth. Go like, okay, have you ever asked them what toothpaste they like to use or what toothbrush? Maybe it's as simple as changing that toothbrush or toothpaste, right? So they wake up and you can use that to sell the waking up to them, like, oh, why don't you wake up and you can use your bubblegum toothpaste, and they would wake up and there's something to look forward to. So we tap on what motivates them, right?
So don't instill fear, like, if you don't brush your teeth will decay, then we have to go to the dentist. So it's either you brush your teeth now or we go to the dentist.
The fear.
I mean, because that's a lot of parents would say that, right? You don't want to brush your teeth? Let's go to the dentist instead and get him to clean your teeth.
Or pull them all out.
Yeah, exactly.
So procrastination is a little bit unique, right? We know the negative consequences already, and yet still continue to, procrastinate. So it's not that we don't know the consequences. That is a bit different.
Got it.
So
Okay.
even if you continue to instill fear, it's not going to deter. They can reiterate what you've just told them, but they might not know how to change their behavior until we help them to find a different emotion or motivator.
So make them like the task that they don't normally like to do, right? Make it more interesting.
We can make it more interesting. We can make it more less effortful, or a little bit more neutral when they approach it.
Got it.
Okay. So we've been talking a lot about, I don't want to call this third party love, but like for instance, if you are a parent and you're trying to break a cycle of procrastination out of your kids, but what if it's a personal thing? What if now I am an adult and I realize actually when it comes to work and my career, my day-to-day activities, I'm actually quite a procrastinator, okay? And I'm not talking about, people just like nagging at you for years. You've come to that own self-realization. What can you tell yourself and what can you start doing to get out of it yourself?
Okay, so one of the biggest myths that I realize when the adults come to me is they say, fix me. And when I'm fixed, I will be, I'll be able to perform better. I'll be able to procrastinate less or do this and do that. So I guess for procrastination, I want to encourage all of us to just do, because if you think that you need to be in the right frame of mind or you need to be fixed before you can do it, then you'll be waiting and waiting and waiting, and there never can be a right time. So what we want to do is to have you start making tiny changes along the way.
Okay, let's be Tuesdays, and we have Francis that messaged in on our WhatsApp, and he says, while we have mentioned that procrastination sometimes boils down to being lazy, that was the old thought that Francis had in the past. I think it's not that simple, but something more deep-seated psychologically. And I suppose this is where you jump in, Dr. Jerry, because Francis says, because when it comes to crunch time and that task or project needs to be completed, that person can stay up 2 to 3 nights in a row, pushing 24 to 60 hours straight just to finish that job. That's not laziness anymore. It's like like something is blocking them, and somehow the impending deadline will eventually trigger them to complete their work. I feel there's something different that he might be talking about here.
Well, we
Because
see
he's
that
actually
a lot.
working at it, right?
So we see that a lot in our ADHD clients, where if you give them too long a period of time, it doesn't work because in their minds they would not know how to strategize the time or to organize the time. But and there's no impetus to complete the task because I have perhaps 3 months versus 3 hours or 3 days. So so the closer the deadline, the more the motivation, the excitement, the thrill. So there's another emotion that comes in, that allows them to have that hyper focus. So they get very excited. So you have university students, and you hear this story all the time where, let's say, they want to go for a trip, so they've planned a trip with their friends, right? But the deadline is just before that deadline that they will need to leave.
Yeah.
So what do? They will stay up, complete their projects in like 3 to 5 days, and then go for that holiday. So they are motivated by that trip.
Actually, while you were talking about that actually reminded me of my uni life. All right. In my final semester of uni, right, I had an essay that I had to do and all that. It was like a thesis. And I remembered I waited all the way until the night before. And even the night before, I couldn't bring myself to get started on it. So I did everything. I cleaned the cupboards. I cleaned the house. I had a very clean apartment. But somehow, as the hours ticked by, and I remember exactly when it happened. It was exactly 3 hours before the deadline. Yeah. I sat down and boom, I was in the zone.
Wow,
we've heard that phrase a lot, right? Suddenly just in the zone, tunnel vision, hyper focus, nothing else around the world matters except you and your assignment.
So has Tim got ADHD then?
I've always suspected. What do you think?
I don't know. I cannot diagnose you just
soon.
Okay, Dr. Geraldine, I wanted to ask you, and maybe we can touch on this very quickly. Is procrastination contagious? When it comes to parents to kids, vice versa, employers to employees, can it catch on quite quickly?
If you're talking about like a work culture, you're talking about home culture,
Then yes.
Well, if you're in the environment and you see that there's no detriment, you may pick up certain habits from your environment, like, oh, don't have to worry, we'll get there on time, don't have to worry, they will wait for us, and you have the next generation maybe picking up these habits just because they see that, hey, I can do it because it's functional. It doesn't bring any sort of detriment or super severe negative consequences. So you might still test the boundary. Remember that all of us love to test boundaries anyways.
It almost seems like a don't care attitude, doesn't it? It's oh, don't worry, it can be done later. And then when you really start to panic at the last minute Tuesdays.
Who are these 27 people who say they don't
27%.
Who are these 27% who say they don't procrastinate?
Put your hands up now.
Yes.
It's meant to be anonymous. Yes.
Don't bluff.
Mol says, I usually don't procrastinate when it comes to tasks I can do on my own. What I tend to procrastinate about are matters that involve negotiating with someone, like getting consent or approval, or even an argument, I feel. Like something that needs to be hashed out with someone. You just don't want that confrontation.
I get
right?
that. Which is why I suppose, Dr. Jerry mentioned earlier, they will do their work, but they don't want to see their boss over a meeting or their managers or something like that. Some sort of human engagement.
Yeah, it could be uncomfortable. So situations that, cause us discomfort, we talk about the negative emotions, right? So being aware of what these negative emotions are can really help us. I guess what we haven't really spoken about was, or is the low self-esteem or low confidence, and sometimes when we feel like you're less than, you're not good enough, it pushes you away from a task.
Right.
So you might feel like talking to your manager or talking to your team lead, you feel smaller, you feel less than, or you don't feel as competent. You might delay that encounter. Or if you feel like you can't do well enough for an assignment, so some of the students are like that, they feel they can't do well enough, so they can't bring themselves to even start the assignments.
Right. Okay. Now, you started to touch on this earlier on when we talked about how to break out of that procrastination cycle, right? Especially if you are now aware that you have that issue. And one of the things you said was to just do it, okay? And you need to start taking baby steps. Would you like to carry on from there?
Take the bull by the horns.
So the why I mentioned that is we need to not try to look for the right moment to do it. Okay, so when Tim says, oh, it just comes to you and I'm in the zone, not all of us can get into the zone. So I would not want to wait for that moment, because not all of us can have that. So it's just starting and allowing yourself to recognize it doesn't matter what frame of mind, just do it. The other thing is to break the task up into smaller, more manageable pieces. We keep saying this, but many people just look at a task and they look at the entirety of a task, which can be very, very daunting. So we actually want to break that up for them. Yeah. So even for someone with depression, they can be so severe that they don't even want to wash their face.
So what's the point, right, to them?
Yeah. So it could be, and I've broken it down to, for someone just sitting outside the toilet. Then from sitting outside the toilet, move into the toilet. Move into the toilet, just shifting, your facial wash in front of you. And sometimes even opening that, the facial wash is a chore. So that becomes another task for them to do. So it's really progressive, step by step, breaking up all the steps that we've never really thought about before. Okay. Yeah, so that can be one method. The method that parents love to do is I give you the deadline.
Yeah.
For some people, an external deadline is quite effective. That means I give you the timing. By a certain time, 5 minutes time, we're getting out of the door. I don't care what time your school starts, 5 minutes, we're out of the door. And then that gives the child a little bit of a nudge to move the butts.
You're finishing your vegetables now, otherwise no dessert. Okay, so Dean has come on our Facebook and he disagrees with what we discussed earlier about whether procrastination is contagious in certain environments. Dean says, I grew up in a family that procrastinated a lot, but I was very different from them, being more disciplined and time focused. So family habits need not necessarily pass on.
Totally agree. So earlier we talked about emotions, we talked about personality. So you have different combinations of the different parts of it, and you can act very differently. So we've seen, if we're talking about in a work environment, you can have the whole work environment being very go-getting and very on top of things, but you can have one team member that is not, despite the entire work environment being very excitable.
But how do you choose something like that, like what Dean mentioned, right? Everybody else in your family, just imagine, right? They're all sitting around, not a care in the world, nothing's urgent, we don't need to get to that wedding on time, it's okay, they'll all wait for us. And then you have this one child or one adult in the family that's like, okay guys, we gotta go because we need to be on time and stuff, and this person is already, I'm just giving like a very vague situation, all ready to leave the house, but everyone's still kind of like dragging their feet and all that. I mean, how do you, as the person who wants to make everyone punctual and be on time, get herd the family together to do the same? Or do you just like walk out the door and say, you know what, you guys can do you, I'm going to do me, and I'll see you later kind of thing,
I would think, because at the end of the day, we're all human, right?
Yeah.
And you need to want to do this for yourself.
Otherwise, you
right?
procrastinate, right? Like
Absolutely.
you said. Yeah.
So, Dr. Jerry is giving us some tips and some tricks, things that we can try doing. But, am I wrong to say at the end of the day, it really comes down to them and how they motivate themselves
You
and how
need
they
to
are
want
aware.
to do it. Yeah.
So we're talking about the individual and the change happening from the individual. So in Angel's situation, what I'm hearing is that the person that is very motivated feels responsible to motivate the rest of the group or the rest of the herd, right? So my question would be, are we really responsible for it?
And we are talking about procrastination. We've got a fun little poll going on our Facebook page. A little bit too late for you to join right now because we're about to wrap it up. So, Dr. Jerry, we always wish we had more time with you, but we don't. So, on the topic of procrastination, I know, right? It's already 8:41. On the topic of procrastination, what can you say to someone who's just tuning in now, and then you can finish it off with your quote?
Yeah. I guess with whatever that we mentioned, right? One major thing that I want to remind everyone, if your procrastination is linked to stress, task avoidance only brings that temporary relief to you. So let's deal with the stress and break the task down into more manageable pieces so that you can complete the task in good time. But I like what Mark Twain says about, time and tide. Remember I'm not sure whether you have heard, time and tide waits for no man. I've heard that a million times over. But this is what Mark Twain says. Time and tide waits for no man, a pompous and self-satisfied proverb, and was true for 1 billion years. But in our day of electric wires and water ballast, we turn it around. Man waits not for time nor tide. So I like it because I always say that we are in control of our behavior. And he, many, many years ago had already said it in his way, in a very poetic way.
Yeah.
I like that. We're living in the age of electrical wires.
There you go.
When was this?
And they say time and tide wait for no man, but I guess the ladies are the exception because they're the women. No man, but they'll wait for the women.
Oh, yes.
So ladies, you can take your time.
All right. On that note, our poll came up. 32% said no, they do not procrastinate, and 68% say yes. Thank you very much, Dr. Geraldine Tan. We'll see you again next Tuesday.
Thank you.